So, Dr. Zayshawn, I was told that autism was the child sitting in the corner, nonverbal, rocking back and forth. So, how is my child who is verbal and has so many talents being diagnosed with autism?
I think that's a very common myth I have seen parents to have, and in some movies, and what they may have heard about the autism, nonverbal, being angry, being irritable, throwing things, rocking back and forth, unable to transition. So those are also symptom of autism. That's why, autism is a spectrum. On one spectrum, you can see all those features. And on one spectrum, you may have a child who is verbal, sometimes too verbal,
Mm.
talking out of turn, talking, in churches, in library where they are not supposed to talk, talking out of context, talking without keeping other person perspective. And also, but on the same hand, they have such a high IQ that they can memorize things that,
Mhm.
people with, the neurotypical may not do. I have seen one child, the parents will say, once we are traveling, once the child see the exit, he remember the exit, the name. So they were making fun, if any one of us forget the way to go home, we always call him because he know exactly which route you have to take, which exit you take. That photogenic memory they have. Sometimes they are too much into space, climate, animals, dinosaurs. And IT nowadays, I'm seeing kids with autism, they have in video games, in more creativity because their IQ, so IQ is a very different thing than the autism. So let's say what is the autism? So autism has two characteristics. One is the difficulty communication, and other is a repetitive behavior, repetitive pattern, rigidity, stereotypes. Okay. In communication, we have three things. One is verbal, the problem in verbal communication, like they may be not talking at all or talking very few words or having difficulty verbally communicating. Other is non-verbal communication. Sometimes kids, they may talk, sometimes kids may not talk, but they are communicating their needs through non-verbal. Okay, so and the third is back and forth communication. Back and forth mean taking perspective, taking turn, not getting too frustrated, playing together. So if all those threes are affected, that is part of the autism. There is another diagnosis called speech delay. So in speech delay, the child is not talking, but able to communicate through nonverbal, point towards it, hold parent's hand to communicate the need, share their feelings, share their anger non-verbally, continue to play, continue to show interest in playing and playing with others, taking turns, but their speech is delay. So they have speech delay, not autism. Okay. So that is one part of it. The other part of the autism is the repetitive behavior, the stereotype is, running around, hand flapping, opening and closing the door, lot of sensitivity with the tags, with the food texture, with the temperature, um, clothing texture, and then the sensitivity to light, to loud noise. And you can say, so they are just very literal. They cannot move when they get stuck. They are playing, with the lining up toys. Things need to be done in a certain way. So when both the communication piece and the stereotypic and the rigidity are together, we call it autism. Let's say if the child is only struggling with the difficulty communication but nothing here, the child may have a social pragmatic disorder or a speech delay, but not the autism. Let's say the child has these, like they are very sensitive, they are they cannot have tags, they cannot have texture, but nothing on this end. They may have a sensory integration or sensory regulation, the disorder, where they need more like an occupational therapy. Many times I have come kids labeled with autism because, the child has so much sensitivity to tags, cannot have texture, but they are very verbal, but they were labeled as autism. you know. Sometime I have completely opposite, you know, the child is struggling with communication, you know, but they are labeled as social anxiety, you know, because they are struggling but not seeing the whole picture. So I think it's important to understand what the autism is. It's
Mhm.
important to understand kids with autism is a spectrum, can have a lot of high potential. They can be academically really well. They can be very successful. They have a lot of strength. They have a lot of potential, but they also have some vulnerability as well.
Thank you so much for explaining that to me. It makes so much sense.
No, no, thank you for asking that question.